Good morning, everyone. Good morning, everyone. Nice having every one of us in this first day.
Good morning.
It's so nice having every one of us in this first day of the training session. And just as we discussed last week, we'll be having a quick session today. And the first session we'll be having will be handled by Dr. Samuel himself, who is the company's who is handling the company's operation, and he will be taking us on healthcare management, strategies, and operation. I hope we have our pen and papers, because at the end of every session there will be a short test for us to work on. So right now I'll be bringing Dr. Sam on board to take his session, and I hope to speak to every one of us at the end of the class. Have a nice session. Thank you.
Thank you very much, our Global HR. Good morning. How are you today? Can you all hear me? Please, I would like you to turn on your camera so we can hear you, we can see you. And we're trying to ensure that this is very brief as much as possible, because we also understand that data is not easy to come by, especially in Nigeria. So we just want to ensure that this is fast as possible to conserve your data. But please, could you turn on your camera so you can actually blur your background. If you don't want us to see your background, you can blur your background, okay? But please, it's very important for us to see your faces. So my name, once again, is Samuel Matthew Olomo, and I'm the Optispectrum Retail Business Management Professional, all right? And I'm resident here in Dubai. So today we're going to be thank you very much for turning on your cameras. So today, can you all hear me? Can you hear me, please?
Yes, sir.
Yes, we can.
So today we're going to be taking healthcare management, all right? And we'll be taking what we call operations, strategies and operations. So I'm going to share my slide so that we can begin right away. Okay. So we're here. If you can see my screen, please indicate. Can you see my screen?
Yes, we can.
All right. Thank you very much. So healthcare management. You can turn off your cameras, okay, just to conserve your data, all right? We just wanted to see your faces and where you're connected from. To conserve your data, please, you can turn off your cameras, okay? Because we are humane and we don't want you to exhaust your data, because this is going to run for 4 weeks, once a week, all right? So please, you can turn off your data now. Your cameras now. So we'll just quickly run through. All right, so today we'll be talking about healthcare management, strategies and operations. And don't forget that Optispectrum is all about healthcare. So that's the reason why we are beginning this program with this topic. The other of my colleagues will come and talk about the others later on. So, but today we'll be talking about healthcare management, strategies and operations. So this course is divided into 4 modules. All right. And then at the end of this course, all right, we're going to present to you a short question and answers. It's just 5 questions. And then within 5 minutes, you will just quickly answer them, just to see how you are participating, how you are coping, and how you're following the teachings. All right. This is very, very important, because we want it to be very, very engaging. Please have your paper, your pen, and please listen attentively, all right? And please, you can ask questions. You can raise your hand if you want to ask questions, or you can use the chat box, all right? Send your question to the chat box, or you can raise a hand if you want to speak directly, All right. Anywhere you are at a loss, or you want me to repeat something, or you want me to clarify something, please just indicate with your hand, or you can use the chat box. All right. So let's move forward. So like I said, this course is divided into 5 modules, and they are overview of healthcare trends and models, and understanding workable management strategies and operations, implementing workable health management models in diversified and competitive environments. And we also have health management strategies and operations, compliance with industry standard, and managing outcomes and forecast, introduction to medical commerce. The 5th session or 5th module is actually a practical demonstration where we will launch you into our company website to see how we do some certain things. Please, you can mute yourself. You're just joining. You can mute yourself if you're just joining. So we will. It's the 5th module is practical session where we will teach you. We'll show you how what is called medical e-commerce to show you from the background what Optispectrum is all about, if time will permit us. All right, because we're trying to compress this thing as much as possible within 45 minutes, so we can be done at most 1 hour, just to save your data. So let's begin with overview of now, what are the objectives? The objectives of this course. What do you stand to benefit from this course? All right. After completing this course module, you will be able to have a general understanding about what healthcare sector is all about. All right. You'll be able to understand healthcare management tools, and at the same time, you'll be able to develop and implement healthcare management tools. So you're not just a listener, you're not just someone who is a spectator, but you are a participator. That's what we want you to be, especially if you are one, you're going to be coming into Optispectrum, or you're going to develop your career along healthcare chain. So you should be able to contribute your quota to the advancement of healthcare in the healthcare industry. Then you'll be able to understand healthcare policies and standards. What are the policies that regulate healthcare? All right, globally as well as within your domain. And also you'll be able to develop career portfolios along the medical and health industry to contributing solutions toward healthcare advancement. As you will understand that the post-COVID era has brought in a lot of reformations in healthcare, and these were disruptive ideas. From the conventional ways we used to administer healthcare solutions. So we want you to be part of that trend, where you can also be able to develop your portfolios along this line while you're also contributing to the industry. All right. So these are the things you stand to benefit. And of course, the learning tools you're going to get from here, you'll be able also to apply them when you are part of us as Optispectrum, or when you are part of any other healthcare organizations. So module 1, overview of healthcare trends and models. So what are healthcare trends? What are the current trends in the healthcare sector? Beginning from 1980s, healthcare has really changed from a traditional setting where it was a human-centric profession to an e-commerce or to a commercial system. So when you view the health sector, yes, it's supposed to be a sector where it is tied to rendering services to humanity, all right? But over time, this idea has changed, has metamorphosed to a different thing. So now it is more of a commerce. So we want to understand the current trends and models in these times, unlike what we used to have in previous times. So introduction. Can you all see my screen, please? Hello, can you see my screen?
Yes, we can.
Yes, we can.
Yes, we can.
All right, great. So since the middle of the 1980s, hospitals and other healthcare organizations have operated in an extremely competitive environment. What that means is that healthcare sectors, because of its diversified nature, because of its dynamic nature, is constantly evolving and changing. And each person or each organization is trying to introduce something new to make them relevant. And by so doing, make them to have a competitive edge, to above their contemporaries. So there has been a lot of changes. So this makes it very, very competitive. And during this period, hospitals have been under increasing pressure to improve quality and reduce costs, of course, because when you are not the only person who is rendering a service, and they say where there is monopoly, there is usually a dearth of innovation. But when there is competition, of course, innovation is stronger, because why? Everybody wants to be the best. Everybody wants to put him or herself, at the edge to ensure that he has an advantage over the other. So also the same thing applies to the health sector. All right, I will try to speak slowly because I know most of us are not in the health sector. Perhaps we have background in other places, but health sector is not only for doctors, it's not only for nurses, it's not only for those who are in the health, who are health professionals. Health sector is for everyone, because we have today, the health sector has metamorphosed to an industry where they are all players. We have administrators who do not even have anything about even medicine. They don't even have what you call an idea of medicine, but they are administrators. We have healthcare managers that don't even know anything, a pin about medicine, but they are managers. So when we're talking about the healthcare sector, it doesn't mean that you have to be a doctor like me, or you have to be a medical expert. No, it's for everyone. So that is why this course is specially for you and for everyone. All right. So I just want you to listen attentively. All right. Now, in responding to this dynamic situation, healthcare managers, like I just told you before, have adopted management techniques that were not part of originally healthcare. Now, they adopted these techniques from different sectors. Why? Because of the competitive edge, to bring it, to make it more relevant. All right. So what are these things that were now brought into healthcare? What are they? Now, let's examine them closely. Now, look at it. Say, in the business of medicine, there are 3 ways to increase revenue. Traditionally, there are 3 ways to increase revenue. One is either you charge more. If, for instance, I am an eye doctor, so if I want to charge you to examine your eyes and I want to make more money, I will just have to charge you more my consultation service, or increase my what we call general examination fee charges. All right. Now, another ways to earn more money or to increase revenue is to do more. For instance, if I'm seeing maybe in a day, I'm supposed to work like 8 hours, and then each hour I am dividing to every 30 minutes or 45 minutes to see one patient. So which means if I'm seeing a patient every 45 minutes, then I should be able to see a maximum of about 9 patients or 10 patients per day. However, if I want to increase more revenue, so I can decide to say, okay, I will have to shorten my timing to see a patient to maybe every 30 minutes, so that it can give me more time to see maybe up to about 15 patients per day. So you do more. So that's the traditional way of increasing revenue. Then the third way is to do the work more efficiently. What does that mean? For instance, if we have competitive doctors, we have doctors everywhere. All right, maybe in the same profession, like I'm an eye doctor, we have other 10 eye doctors. Okay, then who does this operation better, or who does this better? So if I want to do this better, then I must be able to, if I want to increase my revenue, I'll have to sharpen my skills to ensure that every operation I perform comes out excellent well. And when that happens, of course, those patients will begin to refer me to other people. And then when they start coming in bulk, of course, that is going to increase my revenue. All right. So traditionally, these were 3 ways to increase revenue. However, this has not been very, very effective. And so because of this, healthcare managers had to come up with different strategies. And that's what we're going to be examining from onwards. Please, do you understand that? If you don't have any clarity, just let me know so I can explain. Is there anyone who does not have any understanding? Any question? All right. So now, what are the competitive healthcare models and trends? Now, like I told you, traditionally, we had 3 ways to increase revenue. It's either I will do more, all right, charge more or do the work efficiently. But right now, in our contemporary environments where things have changed, all right, so what are the things that healthcare managers have brought in to ensure that, of course, we can increase revenue, we can have a competitive edge over others? And these are the things that healthcare managers were able to bring in. So we examine them one by one, and then I will just quickly explain them to us. Okay, and one of such is patient-focused healthcare. Patient-focused healthcare. Now, patient-focused healthcare means that whatever services we are rendering, it should be patient-centric, meaning it should be focused on the patient first. It shouldn't be commercialized like as it is in what is happening in the industry today. Now, when you go to the hospital, especially in the Western world, even in Nigeria, they will tell you before we attend, maybe it's an emergency situation, they will tell you before we commence operation, you must have a deposit of 500,000 or must have a deposit of 1 million. Now, that's actually anti-hypocritic oath that we swore. All right. And many people lose loved ones because of delayed healthcare, a healthcare that is not patient focused. Now, the primary purpose of healthcare is to deliver service to the patient. So we are not supposed to commercialize them. So what healthcare managers now brought in was to ensure that healthcare should be patient-focused, all right? Then the other one is to pay for performance initiative. Now, if you go to the healthcare, especially in Nigeria or in the Western world, you will understand that there are itinerary of charges. They will tell you some charges that. And if you really look at them, there is no justification for them. And at the end of the day, by the time you sum up those services, you now arrive at a very huge bill to pay. So at the end of the day, this discourages people, especially in the developing nations, to seek healthcare services. Now, what healthcare managers just brought in, therefore, was that we should pay for performance initiatives. So what you are able to do is what the patient should pay for. Now, we also have what we call consumer-directed healthcare plans. All right. And then we also have what we call telehealth and Medicare. And that's what Optispectrum is all about. This is our domain. Telehealth. Telehealth is that we're breaking boundaries. So the situation whereby someone who is in Nigeria can no longer access healthcare through a doctor who is in the US, all right, shouldn't be. Or somebody who is in Nigeria has to travel to Canada to access healthcare. And you know, the capital flight that costs is going to cost a lot of money, all right, to seek what we call medical tourism. So we are eliminating that barrier. Whether in Nigeria or you are in the UK or anywhere you are able to access health on electronic system, on virtually. No. So these are the things that Optispectrum is championing. So this is going to reduce costs on the side of the customer, or that is the patient, and at the same time bring, because people who have this technical know-how or this medical know-how cannot be able to render these services because of what we call national or international laws. For instance, if somebody from Nigeria, a medical doctor who is trained in Nigeria, goes to the UK to practice, he or she has to, go back again to rewrite the professional exam, okay, to be certified in that area. But that shouldn't be, because a doctor is a doctor. It's the same textbook, it's the same training, everything. So that shouldn't be. So that's, again, this telemedicine is trying to bring all inclusivity. And again, that's going to increase revenue. So this is one of the things that healthcare managers has brought into the healthcare system to be able to expand our scope, all right? And then we'll also talk about the patient-focused health, then hospital, medical clinics, and physician pricing transparency. So when you go to people's website, you see how much they are charging per item, per patient. So no longer, you take somebody to the hospital, you don't even know what the amount is going to cost. It's only when they have already rendered the service, then they will now bring the bill. You now put your hand in your ear and say, wait, how do I get this money to pay? No. But before you embark on anything like that, already you see how much each of these items will cost. So this is also part of the things that have been brought into the healthcare system, all right, as part of the healthcare trends and models. Now, there's also evidence-based medicine. There's also called rise of retail medicine, whereby medicine or healthcare services is not just located or confined to brick and mortar big hospitals. No, if you go to, maybe if you are in a place in the civilized society like Dubai or Canada or in the US, you can go to the malls, because what they call markets in Nigeria is what they call malls in abroad or overseas. So you see them healthcare service being rendered in the mall. So no longer in big hospitals, institutions, that are just primarily for that purpose. No. So these are part of the trends that has been brought in. Of course, we also have what we call development of social health maintenance organizations, use of hospitals-based on-site medical group staffing, growth of boutique medical practices, government-enabled patient bounty hunters, and many, many more. So these are some of the examples that healthcare managers have brought in to the system. So let's not just waste time. So we'll just quickly move ahead. Now, that's a wrap up for Module 1. Now we go to Module 2. Module 2 is understanding workable management, strategies, and operation. Here you want to understand what are these strategies and operations for healthcare management. Now, we must understand that for management processes and plans to work and be effective within the healthcare industry, it's important that such plans must be strategic. What does that mean? It means that it has to be futuristic. Why? Why so? It has to be tactic, meaning that it must capture intrinsic changes within the organization or within the body of health. And then it must be dynamic, meaning that it must respond to external changes quickly. Now, I will just quickly give room to one or two persons to tell us why is this necessary. Okay, is somebody willing to let us know why this is necessary? Please, can somebody tell us why it is necessary to do this? So why is it necessary that for healthcare management plans, okay, processes to be effective, it has to be one, strategic, it has to be tactic, and it has to be dynamic? Can somebody tell me? You can use the chat button. Now, the reason is that healthcare, like we have seen from the traditional setting to our modern times, is evolving continuously, is constantly changing, So any plans you must be able to put in place to bring in revenue, to be able to make you have a competitive edge, then it must be strategic, which means it must be futuristic. You must be able to see the future, and at the same time, you shouldn't, lose sight of what is happening currently. Now, I can tell you that before COVID-19 came, many hospitals were running what we call brick and mortar healthcare delivery system. But when COVID-19 came and there was lockdown, hospitals were closed. So the hospitals that were not into telemedicine lost a lot of revenue. They lost out. In fact, as I speak to you, many of them are still struggling to be back on their feet. So this is why, because you never can tell what can happen. COVID can come, something can come, a policy can come and disrupt the whole system. All right. So that's why your plans and your processes for your healthcare, okay, must be strategic. It has to be futuristic. It must envisage these things. And then you must have this mechanism in place to be able to cushion these effects. All right. It must be dynamic. So it must respond to external changes like COVID-19 that has just happened. And even right now, it's still happening in many nations. All right, so this is very, very important, very, very key. And as you are coming on board, we want your minds to be open, because you people are the future of medicine. You people are the future of managers of medicine. You don't have to be an expert, like I said before, because we want you to open your heart and your mind to receive this thing so that you can bring in the innovations that we need for the healthcare industry to thrive. All right. Many people who are rich today, most of the wealthy people in the world today are not medical doctors, but they are innovators, people who bring in innovation into medicine. People like Bill Gates, for instance. All right. They are bringing innovations into medicine. And that's the reason why you have to embrace it, because it's, the sky is the limit. There are lots of opportunities, all right, to sell your ideas to ensure that the healthcare industry is moving and pushing forward. Now, module 3, implementing workable health management models in diversified and competitive environment. Like we said before, healthcare management is no longer the traditional way of brick and mortar, where you have what we call monopoly, where one person just decide and dictate everything. It's either you come to my hospital or you die wherever you are. No, now it's now diversified and it is now competitive. So what are the workable management models we must put in place in this situation, in this scenario? So these are the things that healthcare management has been able to bring in. Now, what we call information analysis. Information analysis. Improvement of healthcare performance, both financially and otherwise, must begin with improvement of operations management. One way for healthcare establishment to improve operations management is to reevaluate their information needs and the way that they analyze operations management data. Now, what that means is just that your body of information has to be reevaluated. For instance, you must be able to say, okay, we have so within a period of this to this, we have this data. So let's analyze it and see what is beneficial to us and what is not beneficial to us. Let's see what is workable and what is not workable, so that we can jettison what is not workable and focus on what is workable. So you must analyze information. The other way, you just rely solely on impulsive thinking or spontaneous actions are no longer there. So you have to ensure that you work with information, all right? And that is where data analysis comes in. So for those of you who are already in the area of data analysis, you can find relevance in the health sector. And what are we analyzing? Now, look at these are the data one should be able to analyze in the healthcare. Depending on the unique establishment, such data may include length of stay. For instance, people don't want to stay too long in the hospital. Why? Because each day you spend in the hospital, you are incurring more money. For instance, the average stay in Nigeria hospitals is 500 naira or 1,000 naira per day. In Dubai, where I stay, the average payment you pay in equivalent of naira, okay, it's about 500 dirhams, and that should be around about 150,000. 150,000 per day. All right, you can imagine what that is per day. So we don't want a situation whereby we create fear in the lives of people who are seeking healthcare services. So we want to analyze this data and see, okay, how long can these people stay in the hospital for a particular ailment? So we want to review this information so that we can shorten this length of stay as much as possible, so that when patients come, they will feel satisfied, they'll be okay, they don't have to incur too much financial burdens, all right? So again, other information are collaboration among organizations. Now we understand that before now, there is no collaborations, all right? Every doctor is just an expert on his own, just doing his own. In fact, if you dare even interfere with any other medical professional, it's an issue, but no longer so. So now we have telemedicine collaboration, whereby a surgeon can be operating on somebody in Nigeria and somebody in the US is viewing and giving instruction to that doctor who is operating. So there is collaboration. There is collaboration. These are part of the innovations that is being, brought in to the healthcare sector. All right. Now, the others are collaboration among organizations, measures of performance, and Six Sigma. Six Sigma is a lean strategy framework, okay, to eliminate waste, whereby we focus on the efficiencies. We hammer more on what can, bring efficiencies, okay, work efficiencies, and eliminate whatever brings wastages, all right? These are part of the things they are bringing in. And how do you measure performance? Of course, you have to talk about quality of clinical outcomes, retention of expert clinical healthcare providers. You have to talk about patient satisfaction. You have to talk about retention of staff and physicians, because if your staffs are not staying, of course, you cannot do the work alone. The physician cannot do the work alone. So you need healthcare managers, you need receptionists, you need orderlies, you need every person to be on board doing their job. You need even the cleaner. The cleaner is very, very important. So everybody is important in the healthcare chain. All right, this is very, very important, so that all these things are the data you need to analyze. Volume of market share growth, revenue, and operation costs. You need to evaluate all these things. These are part of the, what information analysis has to talk about. And then we'll talk about the 5S process manufacturing, which is based on Japanese mantra, all right, where you have to conceive it, you have to eliminate waste, you have to think about quality control and all of that. So these are the body of information that needs to be analyzed. And then we'll talk about process management. What do you do to improve the process? Now you have analyzed the information. Now you need to talk about the process. That is how the thing is done, how it is done, the steps it takes for these things to be actualized. So another way to improve financial performance, all right, is with improved process management. For example, healthcare establishment can use a project management approach to improve their financial reporting process. For instance, we don't adopt what we call project management approaches, for instance, because the healthcare sector was indigenous, all right? It was indigenous, but right now we are beginning to be ubiquitous, meaning that we can thrive anywhere using different frameworks and processes that work in other organizations. And of course, why? Because healthcare managers who do not have any prior atom knowledge of medicine are now beginning to come in to reposition the healthcare sector. And this is the reason why healthcare process management is now adopting what we call project management approach to improve our financial reporting processes. And one of those things that include this process is cost management. We want to know how much things raw materials, all right, cost, all right, how much do these things cost that we use in healthcare delivery, because that is going to help us to be able to do appropriate costing of our consultations, whatever we're doing, all right? So cost management, for instance, evidence-based management research concerning cost can lead to more accurate costing. Such research can provide evidence as to what services cost exactly, that what organization activities are successful in controlling costs, and what impact cost control has on quality and patient outcome. This is very, very important. And that's why if this is not in place, you will find that in most organizations where maybe somebody who is trying to run away from high exorbitant fee goes to another hospital, and then at the end of the day, they are paying dearly for their lives because why? They're evading quality and they are going for what? Quantity. All right. So this must be managed. It must be managed. Another activity for process management is what we call medical activity-based costing. We're not going to waste too much time. We'll just quickly run through. Now, medical activity-based costing, on the other hand, is a systematic cause and effect method of assigning the cost of activities to medical products, health services, patients, or any cost object. Now, it is based on the principle of that medical product and healthcare services consume economic activities. Traditional cost system allocate cost based on direct labor. That is, how much did it cost us to produce this consumable? For instance, in the intensive care unit, we use oxygen for people who are in coma or who are in what we call critical situation, CCU. So, but how much does it cost us to bring this oxygen? All right, we just, use this, how much we have used to acquire this, into just say, for somebody who we are going to put on oxygen, we will charge the patient so amount. But this is not effective. So that's why medical activity-based costing comes in, because we are able to analyze the cost and effects. Cost and effect. This thing is done, and this was the result. This was done. This was the result. So we are correlating cost and effect, and at the end of the day, we come up with a result that will be able to help us to do appropriate costing. All right. So this is what this is saying. And then look at what it says. As a result, traditional systems tend to over cost high volume products, services, and patients, and under cost low volume items. What that means is so items that are constantly selling fast or that we are consuming more frequently, we tend to cost them more. Because why? As we are giving, as they are being churned out, we are also spending more money to bring them in. So at the end of the day, we are costing those things more, but which ought not to be. So it should be a cause and effect relationship. So these are part of the things that healthcare management brought in as a process, as a way of process management or improving what we call process management. They will also have economic order quantity cost analysis. I will just quickly run through because of our time. Economic order quantity cost analysis is an accounting method for minimizing hospital inventory, such as DME, durable medical equipment, EQC analysis measure cost by making three key assumptions now: revenue, depletion, cost per order are stable, just-in-time inventory. What that's supposed to mean is that we are costing things based on what we are able to sell or what we're able to consume. So when we sell that product, all right, how long did it cost us to be able to bring in that product again to be on the shelf? All right, so that relationship is what is being used to factor in this cost analysis. So we are not just assuming, okay, this is the amount, we allocate this amount, we allocate. No, we are using a systematic approach to allocate costs. Another process management is health information technology management. This is very, very important. In fact, this is one of the domain of Optispectrum. We're using information technology to facilitate and analyze data so that therapies or processes cannot be demonstrated to be effective, can be eliminated. So we are, just like we said before, information analysis, we are trying to analyze the body of data we have so that things that are moving forward, we will use this, those things to move the company or the healthcare organization forward. Those that are found not to be efficient, we drop them. So this is what health information technology is all about. And how do you even use this incident? You can use them in so many ways. For instance, the radio frequency identification, whereby you go to, like for instance, if you go to Optispectrum e-commerce website, every item has what they call a product identity. Now, that product identity can be printed in the card, whereby you just scan it, and then you are good to go. You don't have to put in so much information, trying to search this, trying to search that, and then especially when you have a very large volume of data. So health information technology management is also one of the processes for managing healthcare technology or healthcare delivery. Supply chain management, of course, we know what supply chain is. You say a supply chain includes every step that is involved in getting a finished product or services to the customer. And here the customer is the patient. So whatever we do to get them that services or product that they want, the whole process is what we call supply chain management. So improving this also helps to improve the process. Then operation management. Operation management is the administration of business practices to create the highest level of efficiency possible within an organization, including designing and redesigning production process control. These are very, very germane points that we must have, all right, if we must have a very good process management. And lastly, we'll talk about scheduling. Scheduling talks about you have a platform, or you have something that is being used, and that resources is finite, which means it can finish anytime. So how much access do you allow people to use it per time? So you have to schedule. That is why we have on our system in Optispectrum, we have what we call patient booking. So patient booking, there is an allocated time for you to see a particular doctor. Once that allocation is hit, we cannot allow you to book more doctor. We cannot allow you to book. Only those that are within that predefined time can be able to access that particular service. So this is part of what scheduling. Now, human resources development is very crucial. Our HRO, global HR is going to talk about this aspect, so I will not dwell on this issue. Then module 4. Module 4 talks about health management strategies and operation compliance with industry. So when you are bringing in all of these innovations, of course, you have to ensure that they comply with industry standards. So we're going to just examine quickly a few of them. Now, just as an introduction, healthcare compliance is the formal processes or programs enabled to prevent fraud, waste, or abuse within a healthcare entity. A compliance program, on the other hand, is the active, ongoing processes to ensure that legal, ethical, and professional standards are met and communicated through the entire healthcare organization. Now, healthcare compliance laws exist to protect the privacy and safety of patients and to ensure that they have a quality patient experience. Healthcare organizations must follow established policies and protocols to meet or exceed ethical, legal, and professional standards. Aside from devising an effective compliance program, the implementation plays a critical role in its success and in avoiding violations because there are laws. So we don't want to violate these laws. We want to ensure that as we are putting out these reforms, we stay within the law, all right? So creating a program that will map out the steps for your employees and the leaders of the organization to implement policies that support the existing compliance law is what highly recommended. Now, what are the effective healthcare compliance programs features that when you devise these innovative changes, these reformations, they should comply with these features. For instance, you should have a written policies, procedures, and standards of conduct, all right? They should be well written out or spelled out and should be available and accessible to all healthcare providers within the organization. Why are we saying this? Because you are going to be part of the health sector. You are going to be part of the reforms in the health sector, all right? Like I said, you are the managers. You are the managers of the healthcare sector. You are the managers of the innovations that are coming in the future. So you must have these things on ground to ensure that those reforms comply with industry standard and that your organization does not incur violations, all right? So you must build a compliance committee, all right, that oversees this, that oversees the compliance, all right, of this standards or laws that we are talking about. Then you must have a continuous education and training. This is very, very important. Education is very, very germane, all right? Continuous development, continuous training of your employees or industry leaders, all right, to ensure that they comply with relevant laws. Then effective communication is also very key. For instance, if you're saying something and I don't understand, you won't be able to pass the information you want, to pass to me. So we must have a clear communication, effective communication that everyone should understand, because the healthcare sector is biodiverse. It's not just only physicians or healthcare providers, but it's open to all manners of people, including managers. So we must use terms that are clear and legible that everybody should understand. They will also have what we call internal audits and monitoring. This is very, very key. Then disciplinary guidelines. So if people fall short of these things, they should be disciplined. There should be disciplinary framework, all right, provided to ensure that people who violate those laws are sanctioned. Then offense response and corrective steps. So of course, you should have a response system whereby you respond to any change or any violations, all right, and how you correct it or mitigate such issues. So this must be put in place, all right? And then module 5, this is supposed to be a practical demonstration. But before we do that, if you have any question, please, I would like you to share your question. If you have any question, please let us know. So I'm open to receiving questions from you before we go to the practical demonstration. It's just going to be 10 minutes, and then we're not going to waste too much of the time. So Bishola, do you have any question for us?
I have a question, please.
Okay, please go ahead.
Yes. Good morning. My name is Emmanuel from Ilorin,
All right.
Nigeria. My question is regarding telemedicine, since that is what of the spectrum is. That is the area that you focus on. Now, I
Yes.
want to ask, for instance, if there is a patient in Nigeria where we don't know some of our service providers, the internet can be erratic at times. So if there
Yes.
is very critical, maybe operation going on, and you need a very salient information from an expert from abroad.
Yes.
So, and then the network just goes bad at a very critical point. So could that be a one of the flaws in that technique, or do you have anything to say about that, sir?
Yes, actually, yes. That's actually one of the drawbacks. You must understand that every system that has been created for human consumption, all right, always has a flaw. Even the very medicine you take they will tell you it has some side effects. Even the food you eat, if you eat too much, you also have side effects. I mean, normal food you eat, if you overeat, you also have side. So everything has a drawback. So telemedicine has its drawbacks, and that has to do with broadband or bandwidth, and especially in developing nations where broadband is a problem. All right. However, there are many systems that are coming up to ensure that the impact of these are way minimized. And that is the reason why we see a lot of multiple video conferencing software application networks are coming up, that uses less bandwidth. Like instance, Google Meet, for instance, uses a very low bandwidth. Even with 2G or 3G, you can use Google Meet. All right, unlike traditional heavy video conferencing platform like Facebook before, where it was very heavy, before you can even call somebody, it takes a lot of bandwidth. All right, so these are part of the applications that are being developed to minimize or mitigate these bandwidth issues. However, we believe that, going forward in future, where especially now that nations are now signing up for 5G bands, all these things should be eliminated. And of course, again, we are hearing about what we call Internet of Things. Internet of Things is going to bring a revolution where I understand that many of us are here are probably Christians, and you must have heard a lot of gimmicks or a lot of things about Internet of Things. All right. Now, the truth is, there are also the good side of things, there are also the bad side of things. But in the area of telemedicine, Internet of Things is going to play a very crucial role. All right. And it's going to be something that people are going to embrace going forward. I don't know if that answers your question.
Yes, it does. Thank you.
All right.
Indeed.
Any other question? BOA said you missed out on module 3. Okay, I will just quickly give a wrap for module 3. It's not, just give me a minute. So module 3, can you please specify which part of module 3 you were logged out, so that I can share it appropriately? Let me quickly check again. Okay, 4 and 5. Okay, so just give me some minutes. Let me quickly do something about that. Can you see my screen, please? If you can see my screen, just let me know. So,
yes, please, I can.
Okay. So on module 3, we talked about information analysis, all right? We're talking about models, implementing workable healthcare management models in diversified and competitive environment. And we talked about information analysis, where you have to analyze information, all right? And you don't just do things or implement things out of your head or spontaneous actionable plans, or you just do things spontaneously. Now you have to rely on data management. or what we call information analysis. And part of the things you need to analyze are, for instance, length of stay. How long will a patient stay if your organization is the one that admits patient? Optispectrum don't admit patients, so this information is not relevant to us. All right, but for organizations, maybe you may be in an organization that talks about that works where people, hospitals admit patients. So you must review this information, length of stay. You must ensure that you review your data to ensure that your length of stay is shortened as much as possible. So when the patient comes in, all right, from the diagnosis alone, you know how long they should be able to stay in the hospital. And sadly speaking, this is not being implemented in Nigeria and other developing nations. You know, people stay in the hospital unnecessarily. And at the end of the day, they end up in debts that they cannot pay. So you must review this information, length of stay forecasting. So when a patient comes for each situation that requires hospitalization, they already know how long. If they are going to undergo hysterectomy, for instance, they know that, okay, hysterectomy will take like 2 days, maximum 3 days in the hospital. Not the situation whereby people are spending 1 month in the hospital in Nigeria or in other developing nations, all right? Then collaboration among organizations. We are collaborating, like telemedicine that we just talked about. People are doing operation in Nigeria. Somebody in the US is monitoring and give them guidelines. So people are collaborating either on ground or online. So collaboration is part of the information you need to analyze. And then we also talk about measure of performance and Six Sigma. Six Sigma, just like agile frameworks or what we call Scrum framework, is a lean framework whereby you eliminate waste. Any system, any practices in the system that is causing waste is being eliminated, jetted son. While the systems or processes that creates what improvement are what being embraced. That is Six Sigma. And the part of the data you need to analyze for performance are quality clinical outcomes. What are the outcomes? What are the results? When Mr. A did this, what was the result? When Dr. B did this, what was the result? So we use this data, we analyze them. Then retention of experts. Or expert clinical care provider, we notice that, okay, if we hire so people or people with so knowledge background, they usually don't stay long. We have noticed as a trend, you must analyze this data, the patient satisfaction. We notice that when we did this, these are the areas where you usually have a lot of patient satisfaction. So you tailor your organization to work more in that goal, while the area you are getting less satisfaction, you focus on improving yourself in that regard. These are part of analysis of information you need to work on. Then retention of staff and physicians, volume of market share, growth, revenue, operating costs. You must know how much you are earning, how much you are generating for each processes you are undertaking. And then we'll talk about the 5S processes, where it's talking about product management. It's a product management term, 5S process manufacturing, where you are talking about how to eliminate waste, quality control, and all of that if you are into manufacturing, because there are some organizations that manufacture their own products. All right, so these are what we are talking about. Then we also talk about process management as another way of improving your financial outcomes. And we say part of the things that you need to do in process management is cost management. You must know how much you are charging per services, all right? You don't just do things arbitrarily. No, you should be able to, out of data you have at your disposal, know how much you are allocating for each of service that you are rendering based on analysis, all right? And then we also talk about medical activity-based costing, all right, where it is systematic cause and effect method of assigning the cost of activity to medical products, health services, patient, or cost object. Again, you are not just doing things traditionally and say, okay, like for me as an eye doctor, I will say, okay, if I want to perform cataract surgery on you, I will charge you 45,000 naira. Let's assuming. All right, I will just say that, but I will look at what activities, if I want to do cataract surgery, what are the things I need to perform that operation? How long are you going to be in the hospital? What do I need to keep you in the hospital for that length of stay? What are other things that I'm going to do? All these things, body of knowledge must be at play to arrive at how much I'm charging you. All right. So these are what we are talking about. Then we also talk about economic order quantity cost analysis. And this has to do with about revenue. If revenue is constant, a cost per order are constant, are stable. That is, things are not going up and down. When you are finished, you consume your consumables and you want to ship another, they will now tell you, now in China, there is no, the cost of shipping goods is very high now. So these are these, then these are going to affect your prices. All right, so economic order quantity costing is talking about your costs per order, are they stable? So when you have consumed everything that you have and you want to ship in another thing, are you using the same amount that you used to ship before to ship again? If not, this is going to change. You have to analyze all of these things. All right, then your inventory, how long does it take to bring your inventory from where they are? If you are shipping from Australia, UK, how long does it take them to arrive? Is there a delay before the products arrive and then your consumers or your patient are waiting? Some of them are in the ward. They say there are some so product that need for their surgery has not yet arrived and all of that. If those things needs to be put in place when you are doing your economic order quantity cost analysis. All right. So let's move forward. Then we'll talk about health information technology, where we'll talk about reviewing data. All right, using data analysis to affect things or process management. For instance, when you have a lot of multiple products in the shelves or in the inventory, you don't have to go and be taking them manually. No, you have what we call barcodes on them, what we call radio frequency identification number, where you can scan these things. All right, these are part of process improvements. And then we also talk about supply chain management, where we say supply chain includes every step that is involved in getting a finished product or service to the consumer. The consumer here is the patient. That must also be approached, to have effective process management. Then we also talk about operations management. How is the organization run? How do you run the process? Is there efficiency? Are there bottlenecks? All right, that needs to be eliminated. These are very, very germane things that we must consider. All right, and then we'll also talk about scheduling, and I will use an example in Optispectrum where we schedule patient for a particular period. All right, for a particular doctor. For instance, on my page, I have my scheduling for specific days in a week. All right, if you schedule me on a Tuesday, I will not be available. Why? Because on that day, I am engaged elsewhere. So you are trying to schedule to be able to ensure that resources are properly managed. So there is no jump back. You schedule the patient for a doctor, and at the end of the day, the doctor is not able to see the patient. These are bottlenecks. So this does not improve process management. So to improve process management, all of these must be in place. And one of such is scheduling access management. All right. So is that understood now? Did you get that now? Who asked that question earlier on? Abioye, Toby. So do you get that now? Is that okay? Then somebody's asking a question here. I say, good morning. My name is Sao from Togo. Okay, we say, which data analysis software is used most by Optispectrum managers to perform information decision? Yes, we have a lot of this question can be properly spoken of or answered by our IT experts. All right, but I will chat you directly so that we can have a meaningful conversation on that, because some of the strategies that we are also talking about, they may not be supposed to be on the public domain. Why? Because this information, like we said, we are trying to ensure that your organization has a process to make you have what we call a competitive edge over your competitors. So every information we give must ensure that it stays within the organization. And only for those who are going to be retained with us are the ones that are supposed to have this knowledge or this information. So it's not something we can just share, but I will be glad to share with you personally, but not publicly on this platform. Is that okay, Mr. So David? So please remind me. I will share my details with you so you can chat me up privately. Any other question, please, because of time? Is there any other question? All right. In the absence of any question, I will just quickly, we have a question and answers here. So I will just quickly present it to you people now. Yes, please. Okay, Victoria, yes, please ask your question.
Sorry, I have a question about the management, cost management.
Okay. So what question?
You talked about cost management and all. So my question basically is, how do you, for instance, in Nigeria, the exchange rate of dollar to naira is very high.
Yes.
Just like when you gave the instance of stay in hospital or sort of, like the cost in Nigeria is like 500, then over there, you said probably, was it 500 rands or something?
150,000.
So I don't know if you get my point. So how is the cost going to be regulated? Because to people spending dollar, the cost might not be that much, but for people in Nigeria, the cost will be much. I don't know if you get my point.
Yes, I get your point. No, go on.
Yeah, so that's the question, that how do the costs be regulated so that to favor people globally?
Okay. Thank you very much for that question. This is a very, very relevant question, especially in our day, considering the fact that Optispectrum is a global company where we render services to everywhere in the world. All right, irrespective of your geographical location. In fact, one of the vision and mission is that we render services irrespective of your religion, your racial background, your social creed. All right, so how then do we render services that are cost effective, considering people from different backgrounds where the currencies are usually not in the same level? This is very, very important. And that's the reason why I said one of the ways to do this is what we call telemedicine. Telemedicine is able to break these economic barriers, because I said it earlier on when I was making explanation about this whole process. People travel to different countries to seek medical tourism. These are for people who can afford them, because I just learned recently that our president has jetted to UK. I don't know for what reason, perhaps maybe for healthcare. And perhaps that's because he can afford them. But there are many people who cannot even afford 3 square meals per day, under $2. So how then can these people benefit for healthcare programs that, in other climes are very expensive? Telemedicine is the solution, because at the comfort of their home, if they can only pay for the data and then perhaps the consultation fee of that medical doctor, because on our platform, we are subsidizing these amounts, all right? We know that in US, for instance, the average amount to consult a doctor, all right, is $250 and $300. All right. But on our platform, you see some amounts is $50, $70 and thereabout. Now, these are a way of subsidizing these things so that people across board will be able to benefit from this platform. All right. So these are part of the thing that I believe that future of medicine is telemedicine. We are breaking free from the conventional brick and mortar, because of course, brick and mortar is even very expensive to even erect in the first place. You have to build a gigantic hospital with all amenities and all kinds of things. And then after you have done that, now you need to recoup this money. So people who are working for you have to pay their bill, you have to pay their salary and all of that, all right? And then so in the process of time, you see that the wage bill is very, very high. And then what you're now charging your patients is very, very high. But with telemedicine, all you're doing is just creating a platform where people access healthcare. And many a time, they don't need what the problem that these people have don't necessarily necessitate that they need to be physically in the hospital. just diagnose what they have and then recommend appropriate treatment for them that they can go over the counter to buy, or the doctor by his own right, he can request the pharmacologist or the pharmacy to dispense. It's what will solve the issue. So why pay huge bill to go to the hospital to assess these things? All right. I don't know if that answers your question. So these are part of the solutions that can be used in the process of information management to mitigate or reduce these expenses on the side of the consumer. So is that answered?
Yes,
sorry?
yes.
Okay, all right. Thank you very much. So, so I will just quickly review the website just briefly because we don't have time, because we don't want to waste time. I will quickly do this. Please answer this poll, all right? And then we will be done for today. So please, your phone now, please check your phone. You should be able to see those questions. Just quickly answer them, and then we will be done for today. Can you all see the questions? Can you all see the questions, please? We just have 5 minutes to do this, and then after that, we will close for the day. One person has already submitted. We are still waiting for others, please. Thank you very much. 3 persons have submitted. We are still waiting for others. Thank you very much. Keep pouring it in. Thank you very much. 7 persons have submitted. Thank you. Please keep it on, keep it on. This is not a test. It does not have in any way affect you being with us. It's just an engagement to see if you are really following it, if you catch what we have discussed so far. All right, so feel free, all right, just be free and do what you just need to do. So we have 2 more minutes to go, 2 more minutes, and then I will end the poll. We have 11 submitted. We still need from 3 more persons or 2 more persons, or 1 person more, 1 person. So who is the last person that has not submitted?
So Mr. Samuel, I have a bit of network interaction. You just take like a minute, I'll be done with that.
Oh, okay. No, Haruna, how are you?
Yeah.
Are you attempting it now? Are you attempting the question now, or do you want to attempt the question or not?
Yeah.
Okay, so we'll just give you extra 2 minutes so you can just do what you need to do.
No, I'm doing it fine.
Sorry, your network is a bit poor. We can barely hear you. Can you repeat what you just said?
All right, thank you. I said I'm on it.
So while Mr. Haruna is doing what he's doing, I just want to quickly say this, that like I said before, you all are welcome into the healthcare profession. You don't have to be a medical doctor. You don't have to be a nurse. You don't have to have a degree in medicine to pursue relevant portfolios or career in the health sector. And many people today who are blazing trail in the healthcare industry are not in any way near healthcare practice. People like Bill Gates, they don't even know how to even handle an injection or a needle. All right, but today they are making waves. So you don't have to be a healthcare expert. So administrators, managers, they are people who manage healthcare and they are not healthcare experts themselves. So you are highly welcome to pursue healthcare career. And I must tell you that it's a lucrative industry, both home and abroad, anywhere. All you just need are the relevant skill sets. And that's what we are giving you here today. If you want to access this information, this body of knowledge that we're giving you for free now, you have to pay a lot of, thousands of dollars to access them. Just like our global HR said last week, you have to pay, but we understand the needs in Nigeria And this is part of our contribution to our, developing and giving back to society. So please, I will join us to take this very, very seriously. All right, because you never can tell where it will take you to. So, Mr. Haruna, are you through now?
Yes, I'm done. Yeah,
all right,
thank you very much.
All right, thank you very much. So I will quickly show us our, if you want, I can share your results with you. Do you want me to share your results with you? You will be the only one to see. Okay, all right, so okay.
Yeah, that's fine.
So, all right, so I've shared your results with you, so you will see what you have scored, what's and everything. All right, so can you see that? Have you seen your results? Okay, so let's move forward. Let's move forward because of time. Let's move forward, right? So I will just quickly share with you our website and then how we operate. Just only 5 minutes or 3 minutes, and then we will close from here. All right. Can you see my screen?
Yes, sir.
All right. So this is my dashboard. So if you are registered as a doctor on Optispectrum, this is how your dashboard would be. So let me take us to the home site. Let me assume I am not in a dashboard. So we'll go to the main site and see how it works. So this is how our website works. So when you come, you are supposed to register. Let me sign out so that I'll be able to demonstrate these things for us. Okay. So let me log out. So when you sign into https://optispectrum.com, you will see login and join now. So when you click on join now, it will take you to a place where you can sign up as either a hospital, a doctor, or a patient. That is, if you want to seek medical services as a patient or as a vendor, either as a pharmacist or as a laboratory scientist, or people who have something to sell that belongs to the medical field. All right, they can sign up here on the vendor aspect. All right, so for me, assuming I have signed up as a doctor, then after I have signed up, I will now be able to come here to log in. All right, so and then here you can be able to book your appointments. So for doctors who are on ground or who are online, you can book appointments with them. And if you want to read publications, you want to check maybe somebody is having eye problem or you have a stomach ache, you want to know something about what that eye ache is, you can read about them on our publication sessions. All right, where we have a lot of publications like, for instance, the significance of vision. Why is vision important? The role of glutamate. Glutamate is that a simple way to describe glutamate is the Maggi you eat. The Maggi, especially the Maggi on noodles, is made from glutamate, okay? Then why eye care practitioners are, so these are some of the things you can read on our publications to educate yourself. You don't have to be a medical expert to read that. All right, anybody can read things just to keep them abreast. All right, then if you have some specific questions, all right, that is bugging you, you have some, maybe somebody is suffering from stomach infection or something, or you want to have a general inquiry, you can ask questions on the forum. So Head Forum, you click on Head Forum and it will take you to this place where we have a lot of questions, and doctors on our platform will respond to them from time to time. Any question you have, they will respond to it. For instance, somebody said, do COVID-19 recovered patients have any other health risk? This is a question that was posted by somebody, seeking questions, all right? So then again, this one is a persistent headache on my left side of the head. So this person is seeking information in this area. And then this one is saying, how long should my glasses last before changing them? So if you have questions, you can go to the forum session, you ask your questions, and doctors on board will be able to respond to you. These are what platforms that are free, that people that don't even have money, all right, to access healthcare can leverage on. And Optispectrum is championing this cause. We want to provide this information, concrete information from industry experts, all right, to them. Okay. Then here, if you want to shop medical product, this takes you to our e-commerce website. All right. If you click on shop, it takes you to our e-commerce website. Now we have a website separate from our Optispectrum shop. Okay, I mean Optispectrum site. All right. This platform is for people who wants to purchase products. You want to purchase, maybe your doctor has prescribed drugs or something for you, and you need to buy them. So you need to go to shopping area. Of course, the doctor is going to show you a link where you can buy them. So everything is an omni-channel. It's a channel built in one. So you don't need to start looking for anything elsewhere or this or that or that. No, it's in one channel. So everything is available. All right. So you talk about drugs, machine equipment, everything is just right there. We will continue to put in products, pharmacy products, laboratory product as time goes on. But this is not the center where I want to show us today. It's just we want to show you on our main website. All right. Then if you want to contact us, of course, we have our addresses, registered addresses, both in Nigeria and abroad, where you can be able to reach us. And we have forms you can fill. All right. So we have US and Canada, we have Middle East, we have in Nigeria, where you can, reach us. And then if you want to send us a message and you expect a feedback, you can fill this form. Fill the form, and then we will respond to you immediately. You can decide to say we should call you back. For instance, if you request immediate call back, yes or no, you can click yes or no. And then if you click yes, we will be able to call you back immediately. All right. And that's that. Then about us, who are we really? I'm sure some of you must have gone to our website to read about us. All right. We understand that people are seeking solutions, and we are creating this solution for them. People have to go here and there to get these things done, but we want to provide all the solution in one channel. That's the most important. Why do I have to go to, anytime I want to look for Panadol, I will have to go to Sokoto. Then when I want to get tetracycline, I'll go to Shogbo. And when I want to take another thing, I'll go to somewhere else. No, we want everything to be in one platform. So your doctor, your laboratory tests, your drugs, your products, everything on one channel. So that's what Optispectrum is championing. All right. So I will advise you guys to please go log into https://optispectrum.com, then read about us so that you know who we really are, and then you can identify with our mission and visions. Then book appointment. If you want to book appointment, you click on the book appointment. It will take you to the doctors that are available, all right, on different specialties of medicine. Like this is an ophthalmologist, this is an optometrist, this is a neurologist, and all of that. Okay, this is an internal medicine expert, this is an optometrist, okay, this is a pediatrician, and all of this is a dermatologist. So you click on the one that is available, all right, like this lady now is not available. This one is not available. All right, so you have to look for the person that is available. Look at this one is available on some specific days. Right, so this person is available on Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. This person is always available. For me, this is me here. Okay, I'm only available on Mondays, Wednesdays, Fridays in one location. I'm available on Tuesday, Thursday, and Saturday in another location. So you can see that. So when you book these things, the system will assign that patient to me on that particular day, and I'll be able to address this patient on that day, and it will be on telemedicine, like video consultation. So either the patient can select to use a video consultation or through any other digital platform that is available to that patient at that time. So this is how it works. This is how it works. So for me, I will now be able to log in. Let me just quickly log in here. So when I log in, it takes me to my dashboard. So if you register as a doctor or as a patient, you all will have a dashboard. So I will now know how many people have been able to book my appointment. For instance, there's recent appointments which are from Sarah White. Sarah White booked my appointment on the 30th of August. Status is confirmed. All right. So I can view the details of the booking. All right. So and this patient have been seen. So all this information are there. So this is a platform that helps you, helps the person. Now my consultation fee is $50. And now this is very, very small compared to people who are in a traditional brick and mortar where you go to the hospital. The average, like I told you, is about $250, $300. All right. So telemedicine is something that is the future of medicine. And even this price here is negotiable because by the time you see this person cannot even be able to afford it, you have the choice as a doctor to say, no, I will waive up this fee for this patient. All right. These are endless opportunities that are bound on this platform. All right. So this is part of what we are, but because of time, I'm not able to go far. But I am sure that for those of you who will be coming on board with us, we will have the opportunity to share more details with you and to walk with through both on our e-commerce side, how this platform is running, how they're interconnected. All right. I believe on this note, I would call it a day on this on this note because of our time. So that is just what I wanted to show to us. Okay.
Thank you very much, Dr. Sam. That was a very great session. And I believe just like myself, every one of us, we enjoyed the session as a whole. I just want to draw a line on the telemedicine. I will tell you that telemedicine, it's a breaking edge now in the area of medicine, because it has greatly helped, unlike the traditional method whereby everyone has to be in the hospital, for instance. Telemedicine has greatly helped to bridge that gap between going to queue up in the hospital waiting to see a doctor and having immediate access to a doctor online from the comfort of your home. I will tell you, we are in Canada. When we came into Canada, acclimatizing as a family into the environment, though I've been out of Nigeria for a while, but acclimatizing into the Canadian weather was really, really difficult. And at that point in time, there was no Medicare card. Like before you go see a doctor over here, the government has a provision for a Medicare card, and there was no Medicare card. When we went to the hospital, we were told that the fee was between 250 to 300 Canadian dollars, just like what Dr. Sam had said, which is very true. And if you're even paying this fee and being able to see a doctor immediately is a totally different thing. But this time around, you'll be paying a fee and you'll be made to wait for 7-8 hours to see a doctor. Why? Because of the medical shortage. If we go online and we browse the medical system in Canada, everyone will understand that there is this shortage of medical personnel in Canada. So waiting to see a doctor, it's a huge headache. Imagine someone who is sick. I've actually seen people who are, when you say sick to the point of death, but at the same time, they will just tell the person, oh, wait until it gets to your turn. Why? Because there is shortage of personnel. But what has greatly helped us all through this time is the use of this telemedicine, whereby from the comfort of your home, you log in, you speak with a physician, you get your prescription drugs, because most of these pharmacies, it depends on what you go to them. Some, they will tell you to get a prescription. So we are able to easily access all of these just by telemedicine. I remember even here in Canada, we have the Ask a Doctor Canada, where you can just go online and you see a lot of doctors connected. Just tell them your situation. They will ask you for your They will ask you if you've done an X-ray. Some might even refer you to X-ray. They will even make it a priority, because when you have such recommendations and you go to like an X-ray center, they will attend to you more quickly compared to when you just go waiting for your turn in the hospital. It's going to take forever. So telemedicine, I would say, is the breaking edge in the medical line. And I greatly appreciate Dr. Sam for spelling that out to every one of us so clearly. And I would say it's something that every one of us can dive into, and that's the area Optispectrum is breaking into, because we've seen that shortage or that gap in Africa majorly, streamlining it to Nigeria. We've seen it that everyone goes to the hospital, everyone does this, you wait for a doctor, you do this. So in order for you to have your own medicine, except in critical situations, maybe like an urgent surgery or this or that, but just like an headache or a fever or whatsoever, you are able to access this from the comfort of your home. You get your right prescription. You just go to a pharmacy, you get the right medication, not those kind of self prescription that is majorly practiced in Africa. Why? Because going to the hospital is expensive, is a huge headache, even to see a doctor, but this, you can access it globally. We have doctors registered all over the world. I will tell you that I use this platform greatly. I use either the Optispectrum. Before I joined Optispectrum, I would use Ask a Doctor Canada. And then you will see doctors registered in so many countries, in the North America, in the US, in Brazil. You see so many doctors, even in the UAE, because it gives you a platform to not only speak to doctors in your country, to speak to doctors globally that are readily available to attend to you at that very point in time. So you don't waste time in anything. You get your immediate questions answered. So thank you very much once again, Dr. Sam. We'll call it a day here. We'll be having the next session next week, Saturday, at the same time. And that is going to be with me. We'll be discussing organizational management, how to manage your manager. I know in organizations, some people are being faced with some crazy managers. How you as an employee can manage your manager. I'll be taking us through that part next week. And I'll also be taking us through the part of diversity and inclusion in an organization, how to easily fit into the system wherever you find your place. I know sometimes fitting into systems in organization could be very difficult. Some people see that as a barrier to change. I know a few people who just remain in their organization because they think of, okay, if I get a new job, I will start fitting into the system, fitting into this. So that diversity and inclusion, we'll be discussing it next week, how to break into every organization, that from day one, you start running the race in the organization and you start being even the most preferred. So all of those sessions we'll be having with me next week. So I just want to appreciate every one of us who connected to this session today. And I want to tell us that I will tell you this training being offered by Optispectrum is going to be something that you will take in, not just going through it because, you just want to go through the training session, but rather after going through this 4 intensive session, you'll be able to fit into any organization, just like what we said last week Saturday. It might not necessarily be you ending up with Optispectrum. All right, it could be any organization. You could just find yourself in any system, and from day one, you'll be able to kickstart and just blend into the system. So that's the essence of this session, and I know it will be very beneficial for every one of us. I want to thank us all again for joining in today, and I hope you have a very wonderful Saturday. Have a very wonderful morning, and see you next week. So if you have any question, please feel free to send it on the chat box. Feel free to contact me on the LinkedIn. Last week I had shared my LinkedIn is Faith E. Omo. You can check me out on LinkedIn. Feel free to contact me. Feel free to send in your questions. Also, Dr. Sam is on LinkedIn as well. Just contact us and we'll be right here to attend to you. Thank you very much and have a wonderful day. Thank you. Have a wonderful day. Bye.
Yeah, you too.
Thank you.
Thank you.
Thank you.
Thank you. Have a nice day.